or in BHM 102. So first is occupational hazard for healthcare workers. So first we'll learn about the occupational hazards which is there for the healthcare worker, those who are working in healthcare facilities. So so what is the objective of this chapter? The chapter to after learning or after going through this chapter, you will describe about the occupational hazard to healthcare worker. Also, we'll discuss the risk to healthcare worker from different type of hazards which are there in the healthcare facilities. Enumerate the preventive measure to reduce the risk from the hazards. If the hazards are there, then we have to reduce the hazard and also the risk so that the workers are safe at the workplace. Outline the procedure for dealing with spill and exposure to infectious waste. We'll discuss about the hierarchy of the control, what is the different steps or different hierarchy of control of hazards and risk. Developing an organizational safety culture through policy, training, education, ensuring reporting and adopting and correct practices. That means we need to develop organizational safety, the procedure which the organization will follow, the safety procedure which the organization will follow through its policies, training, and education. Education means workers' education. And also, this policy will ensure reporting of any incident or near miss. Light, list the right of the worker for occupational safety. All workers working in any industry, they have some right regarding occupational safety. Then we'll list the workers' right related to occupational safety. So first we'll learn what is hazard and what is risk, because most of the time we'll talk about hazards at workplace, the risk to the workers. So what is hazard? Hazard is a situation that poses potential risk or threat to life, health, or environment. So what does it mean? It's hazard is a situation which is there at the workplace which causes a risk or threat to life or health or to the environment. Suppose there is no risk to the health or life, but it causes environmental impact, then also it's a hazard. Then what is risk? Risk is the probability of a negative outcome from exposure to hazard. If a hazard is there and you are exposed to that risk or that hazard, then due to that hazard, there is a probability of negative outcome, then it becomes a risk factor. If there is no negative outcome, then it's not a risk. So risk is there when there is a negative outcome from exposure to the hazard. I think it's a clear between hazards and risk. Now, classification of hazard that are dangerous. So what are the different hazards that are dangerous? First is chemical hazards. What are those? Chemical hazards arising from liquid, solid, dust, fumes, vapor, and gases. These are the chemical hazards. Then physical hazards, it's like noise, vibration, unsatisfactory lighting, radiation, and extreme temperature. So these are physical hazards. Biological hazards such as bacteria, viruses, infection, water, and infestation. So there are two terms, infection and infestation. Infection is by bacteria or virus. Infestation is by the worms like roundworm, pinworms, tapeworms. These are infestation. So there are two terms which are similar in pronunciation but having different spelling and different meaning. Then fourth is psychological hazards resulting from stress and strain. Then hazard associated with the non-application of ergonomic principle. For example, badly designed machinery, mechanical devices and tools used by the worker, improper sitting and workstation, or poorly designed work practices. So ergonomics is like, if you, in very simple term, making workplace or workplace suitable for the worker. Suppose if a worker is working on machine and the position of the machine is such that all the time he has to keep his hand at the shoulder level, then the person will not able to work for a long time because he cannot keep his hand at the shoulder level for a long time. So positioning of the machine, positioning of the table, height of the chair, these comes under ergonomics. So this is also very important. If ergonomically workstation is not proper, then it will cause hazard to the worker. Number six is radiation hazards. Well, these are the, I think you have read about radiation, different radiation hazard in other course. Here also we'll discuss about radiation hazard later on. Now, type of hazards and risk to healthcare workers. So what are hazards which are there for the healthcare worker when they are working at the healthcare facility? They are physical hazards and risk, biological, chemical, chemical waste including disinfectant used for waste treatment, radioactive and cytotoxic waste, hazards and risk during treatment and disposal of waste, then psychological hazards. So these are the hazards which the workers are exposed at the healthcare facilities. The physical hazards, as I told you, ergonomics is a design of work task to best suit the capability of the worker. Like, as I explained earlier, ergonomics is design of work tasks which best suits the capability of the worker. Physical risk causing musculoskeletal disorder. What are the physical or musculoskeletal disorder which may cause due to physical risk? The injury to healthcare occurs due to manual handling. So at the healthcare facilities, most of the patient shifting from one place to another is done by manual handling. Shifting the patient from ward to operation theater, from ward to lab, is done by manually. Adopting an awkward or static posture while treating patient for a long time. That means when during operation theater or during any procedure, when treating a patient, the physician or surgeon has to be in a awkward position for a very long time. And this may cause strain or stress on the back, on the shoulder, on the neck. Healthcare workers handling waste are also exposed to backache and strain due to bad body mechanics. Healthcare workers handling waste. When they are carrying the waste or when they are collecting the waste, they are exposed to backaches and strain due to bad body mechanics. So these are the few factors, physical factor. Now, as I told you, the musculoskeletal disorder in healthcare. You can see it in this figure. The first one, the person is lifting a weight just by bending at the hip joint. So if he is doing lifting weight in this manner, he will strain his back, which is a wrong procedure. For best procedure is to bend his knee, then lift the hold the weight and then stand up. In this way, the back will be safe and he will not hurt his back. So how, as from the previous slide, you can very well say that you can prevent the physical hazard or you can take care of the physical hazard following proper mechanics on training of the personnel. If you know what is the correct posture or what is the best way of lifting patient or lifting a heavy object, then you will be safe. So it's a proper mechanics and training of the person which will take care of physical hazards. That biological hazard. This is contact with patient or contaminated material like body fluid, contaminated surface, waste, injuries from sharp, etc. This will cause biological. This will be a biological hazard because when you come in contact with any contaminated material which is been soaked with body fluid or contaminated waste or injury from the sharp, because most of the time always, or you can say always, sharps are contaminated with body fluid or blood. So if a person come in contact with these items, so the chances of getting infection is very high. Aerosolized pathogen containing contacted during loading, compaction, or breakup of untreated waste. So when the biomedical waste is loaded on the borrow wheels or in the truck, or when there is compaction or compaction is done. Compaction means when suppose there is a stack of biomedical waste. To reduce its size, you need to compress it. During compression also, the aerosol or the dust will come into the atmosphere. The dust will contains microorganism because it is from the contaminated waste. So when that dust which is there in the atmosphere is inhaled by a person or who is working near that area, he will be he will get infected. So this is biological hazard and how the person is exposed. So action for prevention of injury from sharp. So how can you prevent injury from sharp? The first is if you are wearing proper personal protective equipment. Personal protective equipments are like gloves, face shield, goggles, apron, safety shoes. These are called personal protective equipment. And second is not bending, recapping, or removing contaminated needle and other sharps unless such an act is required by a specific procedure or has no feasible alternative. So, as you know, during injection, it is always advised that you don't recap the needle, don't bend the needle, and don't keep the needle unattended on the table or any other place. As soon as you give the injection, dispose the needle and the syringe properly as per the let down procedure. The needle should be in the puncture proof box and syringe in the proper container. No recapping, bending or of the needle or keeping the used syringe unattended on the table or the nursing station table. For the prevention of injury from sharp following, things are considered. So what? First is wearing a PP. That is the first thing. Properly cleaning and maintaining floor to avoid slip and fall. If the floor is wet, it's not cleaned properly, then slip and fall is very common. So if the floor is wet, the proper signage should be placed at the wet area, which indicate the floor is wet, be cautious. So that the person who is coming in that area, he will see the signage and he will take care of that area. He will be careful and he will not fall. And no, I already told you about bending, recapping, and other things about the needle. Other recommendation for minimization of risk of infection from needle stick injury. What are the other recommendation by which you can reduce the risk of needle stick injury? First is reduce unnecessary injection. That means if not actually required or not urgently required, don't give injection. Reduce the injection as much as possible. Then use needleless devices. Nowadays, in place of needle, there are jet injection where no needle is used. So we can go for the jet injections. Use engineered needle that automatically retract, blunt, resheath, or disable the sharps. So there are injections where after giving the injection, the needle retract inside the syringe. Or secondly, the tip get blunt. Thus, it prevents the needle stick injury. Destruction of the needle can be done by needle melter or needle cutter. So needle melter or needle cutter is it's a melter is mostly electrical operated where you put the needle inside the melter and the needle will melt. Or needle cutter is either mechanical or electric operated where the needle can be cut. There is a small hole, put the needle inside that hole and there is a blade which will cut the needle. Now, chemical waste, including disinfectant, used for waste treatment. As you know, the lot of chemicals are used at the healthcare facility, either for disinfectant or for bleaching purpose. One of them is glutaldehyde, then sodium hypochlorite. The glutaldehyde is a powerful cold disinfectant used widely in hospital and healthcare centers. It's widely used. But if the person exposed to glutaldehyde, there will be irritation to the eyes, nose, and throat. It may cause severe skin allergy. It may cause dermatitis and skin irritation, headache, and if inhaled, if the fume goes inside the lung, then there will be cough or asthma-like condition. That means he will have respiratory distress. Sodium hypochlorite, it's a skin and mucous membrane irritant. That means if sodium chloride comes in contact with mucous membrane or skin, it will cause irritation. Then type of radiation. Radiations are of two types. One is ionizing and second is non-ionizing. Ionizing radiations is that radiation where due to due to radiation the electrons comes out of the atom. That means if the atom and in the atom there is electron and positron. So with the help of radiation, the electron is moved out of the atom. But in case of non-ionizing radiation, there is simple vibration of the atom or neutron, but it does not come out of the atom. Ionizing radiations are like X-ray, nuclear medicine, alpha radiation, gamma radiation. Those are ionizing radiation. Non-ionizing radiations are microwave, infrared radiation, and visible light. So they are also hazardous to human body. So next comes psychotoxic drug. This is also hazardous substances. The cytotoxic drugs are the drug which is used for the treatment of cancer. So when we give cytotoxic drug, it kills the cancer cell. But while doing so, they also damage the normal cells. So if a normal person is exposed to cytotoxic drug, it will have a detrimental effect on the health. So what are the measures to be taken in case of cytotoxic drug, exposure to cytotoxic drug? There should be written procedure how the cytotoxic drugs should be used, how it should be stored, what should be done in case of exposure. All procedure, there should be laid down procedures for all the things. Second is provide information on potential hazard and their minimization. That means everybody should be aware of the hazards of psychotoxic drug and how to minimize it. Number C, establish procedure for emergency response in case of spillage or other occupational accident. So suppose if there is accidental spillage of the cytotoxic drug, so there should be procedure how to remove that spillage or how to take care of the spillage and how to dispose of the content by which we have cleaned the spillage. For that, we need to educate and train all the healthcare worker. So without training and education, nothing is possible. So what are the guidelines for safe handling of psychotoxic product? First is separate collection of the waste. For the cytotoxic drug, there will be separate collection of the waste. A return of outdated drugs to the supplier. Suppose at the hospital, medicines or the cytotoxic drug are there, which has expired. This cannot be used, but after expiry also, it will be having toxic effect. So this medicine or this psychotoxic drug should be returned back to the supplier, and it should be stored at the separate place, not along with the other drugs. Arrangement for the disposal of contaminated for the treatment of infectious waste contaminated. There is spelling mistake. So if there is any contamination with the cytotoxic drug, that things should be disposed of separately. Arrangement for There is also a spelling mistake. It's the arrangement for the control and disposal of psychotoxic product. What now we'll talk about deficient operating condition causing hazard or burn technology for of the burn technology. As you know, the biomedical waste is treated by incinerator. So the incinerator is using the burn technology. So the person who is working at the incinerator, they are exposed to hazards of because of the fire which is there in the incinerator. So what are the condition by which the burn technology will produce hazard to the healthcare worker? First is short residual residence time. If the product is for the shorter duration inside the incinerator, then there will be more toxic gas release in the atmosphere. Second, if there is low oxygen, the fuel which goes inside the incinerator is mixed with oxygen. But if due to some reason there is low oxygen mixed with the fuel, then there will be improper burning inside the incineration. If there is improper burning, there will be more production of toxic gases which will be released in the atmosphere. Suppose because of the low oxygen, the temperature which is required in the incinerator will not be reached because there is not sufficient or proper fuel in the incinerator. And if there is no proper fuel in the incinerator, it will not produce the desired temperature inside the incinerator. And when the biomedical waste is burned at the low temperature, there will be release of toxic gases. Or if the soil or ash which is produced after burning of the material, there is fallout of that soil or ash, it will cause pressure buildup in the combustion chamber. That will also cause release of toxic gas. The incinerator slag buildup. Slag is also the end product after the materials are or biomedical waste are burned. So if there is a more slag inside the incinerator, it will cause more production of toxic gases. Likewise, waste surge is also the same, or poor gas mixing in the combustion chamber due to low turbulence within the chamber and high halogen content of the waste feed. If the waste which is been fed into the incinerator contains more amount of halogen, then there will be more release of toxic gases and it will cause damage to worker who is working there in the near the incinerator. So hazards are working with the non-burn technology. First, we talk about the burn technology. Now, hazard of working with non-burn technology. So, non-burn technologies are like microwaves, then autoclaves. In autoclaves, the burning does not take place, but there is production of steam by which the materials are sterilized. So here also the surface will be hot. So person can get scald or burn from the hot surface. The steam which is produced in the chamber that may also cause damage or burn to healthcare worker. Because of the high steam, the temperature where the autoclave is there, the temperature, atmospheric temperature will be more, which will cause heat stress or heat strain. Volatile organic compound and other chemical released into the atmosphere. So when you treat biomedical waste, the volatile organic compounds are released in the atmosphere. Also, toxic pollutants are released from the exhaust stack. Exhaust stacks are chimneys. Ionizing radiation from irradiation process, like a microwave that will produce ionizing radiation. Also, non-ionizing radiation from microwave. Then there will be bad odor. There may be noise pollution in the non-burn technology. And psychological hazards. If the person who is working is not or his job is not secure, he will have stress and strain. And also work related stress. Stress because of the poor working condition. Now, accident and risk to healthcare worker. So, how accident and risk to healthcare worker it occurs when dealing with spillage. When there is spillage of any body fluid, blood, or chemical or mercury, it will cause, it will produce health risk to healthcare worker. So any spillage should be handled properly and for safe procedures should be followed to take care of any spillage. Post-exposure prophylaxis to prevent development of infection in a exposed person. Suppose there is a needle stick injury or a person comes in contact with a HIV positive patient or blood of HIV positive patient. In that case, the person should go for post exposure prophylaxis. That means the person is exposed to blood or body fluid of a person who is either suffering from HIV or hepatitis B or hepatitis C. So there is a risk of developing those diseases. In that case, the worker or the person should be given post-exposure prophylaxis, which contains, in case of hepatitis B, is vaccination. In case of HIV positive cases, it is antiviral medication. As per the laid down rule, he will be provided antiviral medicine so that he does not get the disease. In case of accident or any incident like exposure to a body fluid of infected person is incident. So accidents is suppose like if a person slips and get hurt, that is accident. In case of any accident or incidents, it need to be reported to higher authority. So everything, all like who was involved in the accident, where it happened, on which date it happened, at what time it happened, what was the reason for this accident, everything should be mentioned in the report and should be communicated to higher authority. So, commonly reported environmental health and injury issues. So, what are the commonly reported environmental health and injury issues? One is contaminated leach and surface runout from the land disposal facility affecting down gradient ground and surface water. Suppose, or you can say in most of the countries, mostly biomedical waste is disposed of in landfill. It is not been incinerated and it is not properly disposed of in sanitary landfill. But simple landfill, it is disposed. So what will happen in those landfill, the chemical or the fluid or toxic material which is there in the waste, slowly it will go down and it will penetrate the earth or it will go inside the earth and contaminate the groundwater. Or if it's at the higher place, it will move down to the lower place and contaminate the water bodies or soil over there. And the people who are living by the side of that groundwater or surface water will be affected. The vector-borne diseases will be more because there is abundant waste, and the waste there will be growth of housefly, mosquitoes, which will carry the disease forming organism from that waste to general population. Volatile organic compound in air emission evidence or alter cancer incidence, birth defect, infant mortality, as well as psychological stress for those living near hospital, waste disposal facility, and inadequate control incinerator. That means the person who are staying near the incinerator, or even the population, or even the people those who are staying away from the incinerator, they are exposed to volatile organic compound and other pollutant because of improper burning of biomedical waste in case in the incinerator. Then animal feeding on hospital waste providing a food chain path for transmitting animal to human disease. Uncontrolled waste retaining water and clogged drain, thus leading to stagnant water which encourage mosquito vector abundance. So the waste which is lying on the surface, then it goes into the drain and it clog the drain. When it clogs the drain, there will be stagnation of water, increase vector population, and increase which will increase the number of disease. Uncontrolled waste providing food and breeding site for insect, bird, and rodent. So because of the waste, there will be increase in insects, increase birds and rodent, which will carry the disease forming organism. The responsibility of the occupier. So what is the responsibility of the occupier? He will ensure that waste is properly segregated and it's properly labeled. That all the containers should be properly labeled. He should also ensure that all healthcare waste is pre-treated before it goes out of the premises. and also adequate and secure storage for the waste. So before this, it the waste is taken out, it need to be stored at the healthcare facility, and there should be separate storage facilities for the biomedical waste. Then transportation of the biomedical waste, and he should also take care of the occupational safety of the worker who are dealing in dealing in the handling of the biomedical waste. So these are the responsibility of the occupier. So how, as in the last occupational safety, under occupational safety comes safe culture. The action management take to improve both patient and worker safety. So you need to improve both patient and worker safety at the workplace. So you need to engage your worker or parties. You should ensure that the workers participate in the safety planning. So they should visit the workplace and they should tell about the hazards which they are facing and how to mitigate those hazards. So in all safety planning, workers should be involved. Availability of proper or appropriate protective equipments, that PPE. All workers who are working in the healthcare facilities, and they should have a proper personal protective equipment, which starts from cap for the head, then goggles, face mask, then face shield, apron, gloves, and safety shoes. The influence of group norm regarding acceptable safety practices, that you must ensure that the safety planning which you are doing, the what are the procedure you are writing down, are acceptable to the worker. If those rules and regulations are not acceptable to the worker, they will not follow it. So it should be ensured that they are worker friendly. The organization's socialization process for new personnel. So that means if the new person is engaged at the workplace, so there should be proper socialization so that he will be at ease with his co-worker, and he will also learn from the co-worker about the different safety procedures. The hierarchy of control, how the control measure is put into places, which are the different control measures by which you can eliminate the hazards or reduce the hazard or risk at the workplace. First is elimination of the hazard. Suppose if the hazard is there at the workplace, the best thing is you remove the hazard. But most of the time it cannot be done. You cannot remove the hazard. So how to reduce it? Next steps comes the engineering control. By engineering method, you can control or minimize the hazard. What is engineering control? Like suppose a worker is working in a machine where there is a moving part. So best thing is that you eliminate the hazard by removing the machine, but you cannot do it because that machine is more important for the healthcare facilities. So what you can do, you next will come engineering control. So what engineering control you can put in this machine? You can guard the moving part. You can put a guard over the moving part so that moving part is there, but because of the guard, the worker will not come in contact with the moving part and the risk will be reduced to zero. So that comes the engineering control. Next comes the administrative control. Suppose there is a place where lot of noise is there. So you cannot eliminate the noise. You cannot reduce the noise by engineering control. So in that place comes the administrative control. How administrative control is? What is administrative control? You can ask the worker to work in that area for a minimum period. Suppose 8 hour shift, you can tell the worker that you work in that place for 2 hours. So they on rotation, the different person will go. In that case, what happens? The person is exposed to the noise only for 2 hours, which is under the limit as per the OSHA or International Labour Organization. Instead of 8 hours, you allow the person to work there for only 2 hours or 3 hours, depending on the intensity of the noise. So that comes under administrative control. The practice control. This is more or less the same thing, work practice control. The last one is personal protective equipment. That means if you cannot control hazards or risk by this method, the last comes personal protective equipment. That means give personal protective equipments to the worker which is appropriate for that particular hazard. Suppose if there is a noise, give them air muffler or air plug so that they can put the air plug in the ear and the noise will reduce. Or if they are exposed to contaminants or spillage of blood or body fluid, give them all the protective equipment like face shield, face mask, goggles, gloves, and apron. So that if there is any splash of blood or body fluid, that thing will not be, or the person will not exposed to that body fluid or blood because he will be wearing all the protective equipment. Next is training. Training is very important for all healthcare workers. With the training, you can guide them or you can tell them about the hazards which are there at the workplace and what risk the workers are exposed because of those hazards and how to minimize it. So training is very important for all the workers. It, and this training will involve healthcare staff in planning and conduction of training program. They will also help in finalizing the curriculum and training tool which is used for the training purpose. Implement through pictures, poster, learning exercise, and practical activities. That means when you are giving training to your worker, use pictures, poster, learning exercise, and practical activities. That means you take them to the place where they are actual working and show them the thing which they need to do, or also they will tell you how they are doing it and you can suggest if there any modification is required. For the training purpose, use simple and local language. This is important. You talk to them in their own language so that they can understand the things easily. So what are the specific guidelines and strategy for safety of healthcare worker? The first is universal precaution for all healthcare workers. There is universal precautions. Then use of personal protective equipment. Then hand washing. Then labeling and segregation of healthcare waste. All healthcare waste should be properly segregated and should be labeled properly. proper handling of the radioactive waste, establishing, establishing procedure for disposal of pharmaceutical waste. These are the specific guidelines. So as I told you, workers' right. What are the workers' right? They have right to get trained in language they understand. That you cannot train a person who does not know English in English. Or if he does not know Hindi, you have to give the training in his language which he understands or which he speaks. Then allow work on the machine that are safe. Don't ask a worker to work on a machine which is unsafe, because in that case, if there is any accident, then the blame or the responsibility will come to you. Be provided required safety gears such as gloves and harness and lifeline for fall. So you need to provide all the safety gears to the worker, those who are exposed to hazards, or if they are working at a height, you need to provide them harness or lifeline to prevent fall. Be protected from the toxic chemicals. Request an inspection by appropriate authority and speak to the inspector. That means they have a right to request the inspection of the workplace by the authorities. The authorities may be inspectors of factories or mines inspector or any third party, so that any hazards which is there at the workplace can be identified. And also if there is any injury or illness, it should be reported, and a copy of your medical record, you should be getting it. And any test which is done, its report should be shared with the worker. These are the workers' right. The last, minimum approach to health and safety practices for the healthcare person. What is the minimum approach? First is implementation of standard management procedure. That means there should be standard procedure for all the activities which is taking place at the health center. Hepatitis B vaccination. In in addition to compulsory vaccinations are like BCG, typhoid, and tetanus. Those are the compulsory vaccination. On top of that, the vaccination for hepatitis B should be there. Provision of sharp boxes where injection are being taking place. That means where injections are given, there the sharp container should be there, which is a puncture-proof box where the sharp can be stored. Implementation of standard precautions such as no recapping of the needle after use. This is the standard precaution. The promotion of proper hand hygiene. That means how the hands are clean. It should be properly known to the worker. Availability of minimum of gloves to provide personal protection from patient and body fluid. That means when a person is working with a patient, he should be provided with gloves so that he can wear it while examining the patient or while handling the patient. Allocation of additional role, that is for an infection control nurse to assume responsibility for promoting better workers' safety. That means at the workplace, a Separate infection control nurse should be there who can take care of infection or control of infection at the workplace. Thank you. So this come by this we come to the end of unit 1 of the BHME 102. Now we'll discuss about the unit 2. Is the slide visible?
Yes, sir.
Yes, sir.
Visible.
Okay. Uh, Unit 2 is about the patient safety. The first we were talking about the safety of the worker. Now we'll talk about safety of the patient because that is also very important. This patient safety was not there previously, but of last 10-15 years, the patient safety subject is also brought into the preview of healthcare management. The objective of this chapter is to define patient safety, discuss the need of patient safety, why the patient safety is required, describe the various requirements for patient safety, and reiterate the managerial aspect of patient safety, and also recognize the importance of hospital acquired infection and the role of hospital infection control program in handling patient safety issue. That means the hospital in acquired infection and role of hospital or infection control program. So hospital acquired infection is very important, and it is the infection which a patient develops once he is admitted in the hospital. After 48 hours, if he develops a new infection, suppose a patient is admitted for backache, and after 48 hours he develops chest infection or severe cough, then we say that it is hospital acquired infection. So we need to take care of those acquired infection. So these are the objective of this patient safety. So before that, we'll discuss about few definitions. The one is adverse event. This is an injury that was caused by medical management rather than the underlying disease, and that prolong the hospitalization, produces a disability at the time of discharge or both. That means adverse event is injury that was caused by medical management. The patient is admitted into the hospital for something, and during the procedure, he sustained an injury, and that prolongs his stay in hospital. And at the time of discharge, there is a disability because of this event. Then this event is called adverse event. Then there is error. In error, there is an act of commission and act of omission.
Excuse me, sir.
Yes, please.
Sir, adverse events. If
Hmm.
patient is prolonged staying in hospital and
Hmm.
occur in disability during the discharge time, uh, in that loss, who is the responsible for that things?
No, you are omitting the main thing. This event occurred due to medical management.
Right.
Suppose I will give you an example. Suppose patient is admitted in hospital.
Mm.
He is having difficulty in passing urine,
Yeah.
right? And for that, there is a stricture in the urethra, and for that, dilatation was done,
Yeah.
right? But during dilatation, there was injury to the urethra,
Mm.
right? So
Right.
that injury will prolong his stay in the hospital, and also at the time of discharge, he will have a second condition. The first condition was stricture, but second condition is injury to the urethra, which has
Mm.
caused his stay in the hospital more than he was intended. And at the time of discharge, he is carrying one more injury, right?
Mm. Right.
So this is an adverse event.
Yes, sir, I'm asking just if something is happening with poor patients, so
Hmm.
it is a compensation should give by hospital or some committee.
Compensation is altogether different thing. Here
Okay.
we are talking about the patient safety.
Okay.
We are not talking about the patient's compensation. That is altogether different subject, right?
Right, sir.
That is not under our preview at present.
Okay.
Okay,
Okay, sir.
can we move forward?
Continue, sir. Thank you.
Okay. So next is error. So when we talk about error, there are two things. One is act of commission and act of omission. The act of commission is doing something wrong,
Right.
and act of omission is failing to do the right thing, right? I think somebody's mic is not mute. Okay. So act of commission, that means the patient is admitted into the hospital and wrongly some procedure is done on the patient. Then it is called act of commission. An act of omission is that he was admitted for appendicectomy, but the his appendix was not treated, but his toothache was treated. Then it will be act of omission. That means for which he is been admitted, he is not been treated for that. He is getting treatment for something else. That you can say it's an act of omission. And under this, if leads to undesirable outcome or significant potential for such an outcome, then it comes under error. Next is near miss. When we say near miss, it's a error was committed, but the patient did not experience any clinical harm, either through early detection or sheer luck. That means patient was lucky, he did not suffer from any bad effect. Then we'll call it a near miss. The error was committed, but because of the patient's luck or it was detected early, the patient does not have any adverse effect. Then it will be called near miss. Next is hospital accreditation. Is a hospital accreditation is a self-assessment or external peer assessment process used by healthcare organization to accurately assess their level of performance in relation to established standard and to implement way to continuously improve. That means what is an assessment? Their assessment is of two type. Either it's an internal assessment or external assessment. And why this assessment is done? It is done that the organization or the hospital is following the laid down procedures for giving healthcare facilities to the needy. Suppose there is a laid down procedure for these activities, you have to do these things. So when you do assessment, you have to see that the person who is providing the or who is doing the activities, he is doing as per the laid down practices or laid down procedures. so so that the final outcome is as per desire. So this assessment is done either by the internal team or by the external team. This is a quality assessment so that the hospital perform the activities as per the laid down rules. What is quality health care? It's optimal achievable result for each patient, the avoidance of physician induced complication, and attention to the patient and family needs in a manner that is both cost effective and reasonably documented. The quality health care, you give the proper health care to the patient as per the procedure or as per the standard, and also you should take care of the family need of the patient. Suppose when the family members are visiting the hospital, their need should also be taken care of under this quality health care. It's not only
Sir,
the patient but their family member also when they are inside the hospital.
sir, sir,
Yes, please. Yes, please.
what is physician-induced complication?
Yes, the physician-induced complication, like I gave the example, is iatrogenic. When any injury or any adverse effect is caused by the physician by while doing the procedure, then it is called iatrogenic. Like doing the dilatation or when the patient is there in the hospital for chest infection. So there is condition when needle has to be put into the thorax or chest to take out the fluid from the pleura. Pleura is the covering above the lung. So in some condition there is fluid collection in the pleura. So we put the needle into the pleural cavity to take out the fluid. But if it goes 1 millimeter more, then it will pierce the lung. And if it's a pierce the lung, then it's a iatrogenic because it is been done by the physician. I think I'm clear.
Yes, sir. Clear, sir.
Okay. So that is iatrogenic, physician-induced complications. So what are the causes of adverse event? First is failure due to unsafe clinical practices or poor hand hygiene or unsafe injections. If the unsafe clinical practice, what are unsafe clinical practice? Poor hand hygiene, unsafe injection. So how the patient get infected in the hospital? He is coming for backache, but after 2 days he develops a chest infection. So how he developed chest infection? Because the physician who is treating him may not have the poor hand hygiene. He has not followed the universal practices of hand hygiene. After examining one patient, he need to clean his hand or sterilize his hand with disinfectant. But if he does not, and the person first the person patient which is examined is suffering from chest infection, and after examination he comes to the second person who is having backache and he examine him, then he may develop chest infection because his hand is contaminated with the bacteria or viruses which are carried from one patient number 1 to patient number 2. Next is unsafe process, that is communication failure. The communication failure is very important. If there is a communication failure at the health center, the chances of error is very high. So it should be properly communicated. Everything should be in writing. Name of the patient, body part where it need to be, the procedure need to be done, his age, his sex, everything should be mentioned on the tag so that there is no communication error. That
Sir,
communication,
please give
yes.
an example, sir.
Uh, unsafe process, communication error. Suppose I said, the surgeon says, bring the patient whose name is Ramesh, right? And there are two patients.
Right.
One is Ramesh Chauhan, one is Ramesh Taneja. The poor chap who has gone from the OT to the ward will says, Ramesh, the sister will say, okay, yeah, he is Ramesh. But she has not asked whether he is asking about the Ramesh Taneja or different one. So this is communication gap,
Okay.
right?
Right.
The poor system and process, that culture of the culture to blame. So if there is any error or any mistake in all organization, this is very common to blame other person. So this will be there if there is not laid down procedures, then the blame game comes. But if there is a laid down procedures, everybody knows and he's been trained that this is the laid down procedure, you have to work as per the standard procedures. In that case, the blame game does not happen. Now the patient safety. What is the concept of patient safety? The patient safety is a discipline in healthcare sector that applies safety science method towards the goal of achieving a trustworthy system of healthcare delivery. That means when we talk about the patient safety previously it was not there in medical science, but it came from the safety science method and it was incorporated into the healthcare system by which you deliver trustworthy medical care to the patient for early recovery. Patient safety is also an attribute of healthcare system. It minimizes the incident and impact of and maximizes recovery from adverse event. That means patient safety is an attribute of healthcare system. It's a part of healthcare system which minimizes the incidents. And suppose if the incidents happen, it maximizes the recovery from the adverse event or any incidents or adverse event. If it happens to the patient, then with the patient safety, maximum recovery will take place. It ensures that the patient, when discharged from the hospital, is recovered to the maximum. Objective of the patient safety. It improves the structural system to support quality and efficiency of healthcare and place patient safety at the core of all levels of healthcare. Second is assess the nature and scale of harm to patient and establish a system of reporting and learning at the national level. That means it assess the nature of scale of harm to the patient and establish a system of reporting those incidents which may be at the hospital level and at the national level. Ensure a competent and capable workforce that is aware and sensitive to the patient safety. prevent and control healthcare associated infection. By the objective of patient safety is to prevent and control healthcare associated infection. That means hospital acquired infection. Improve implementation of global patient safety campaign and strengthen patient safety in all health programs, and also strengthen capacity for promote promote patient safety research. That means with the objective of the patient safety is to promote or strengthen the research on patient safety. The quality assurance in reference to patient safety. It, it refers to activities and program intended to assure or promise improvement in quality of care in a defined medical setting or program. Second, it involves assessing or evaluating quality. That means you need to evaluate and assess the quality of healthcare system. Identifying problems or issues with care delivery and designing quality improvement activities to overcome them. That means with the patient safety, you need to identify the issues which are there in the health care delivery system, and you need to take action to overcome those issues which are there in the healthcare delivery system, by which the issue which may be harmful to the patient. Follow up monitoring to make sure the activities did what they were supposed to do. That means you have to monitor the activities. First, you have to find out the activities which are not as per the mark. Then you have to take care of those activities, or you have to overcome those activities or modify those activities. Then you have to monitor whether after modification those activities are rectified or not. If they are not rectified, then again you have to reassess your action plan and take a different approach to take care of those negative activities. What are the causes of adverse event? As I told you, medical communication error. Next is management error and error of judgment. These are the causes of adverse event. If there is a error in communication or there is a management error, the management, how the things are managed, there is error in those activities or manage of judgment. That means while treating a patient, there is an error in judgment, then also there will be adverse effect or adverse event.
Sir, please give an example of errors of judgment.
Sorry, which one?
Errors of judgment. Example.
Errors or judgment. So this is like medical science is based on evidence. Sometimes the evidence are not there, and you have to judge the thing from your experience. Suppose say take a case of simple fever. The causes of fevers are innumerable. You cannot name the causes of fever. Suppose a patient comes to me and seeing the symptom, I say it's a simple viral infection. But I may be missing few of the things or few of the symptoms of the patient, and patient does not recover. So this is error of judgment on my part. He may not be suffering from common flu, it may be acute respiratory distress syndrome. He is coming in the early stage. I am not able to judge, but next day he develops respiratory distress,
Okay, sir.
right?
Okay, sir.
Like pain abdomen. Patient is coming with pain abdomen, but the pain abdomen may be due to different reason. So one person may suspect that he is having mild infection in the abdomen, but the patient was had a blunt injury 2 days back, and there is a bleeding inside. But the history was not taken properly. So there may be error of judgment. The error, it may be so many conditions are there where the judgment is, you may have error in judgment. Uh, okay. Next slide is prevention of adverse event. The patient safety management in health facilities.
Student, class was over.
No, sir.
Sir has finished the class.
No, no.
Not yet.
No, sir. Not yet.
Sir is disconnected.
Sir, this is okay.
Sir, we will wait for some time. We will wait for some time.